Good afternoon, friends. I'm Dr. Aajay Shah, and we are bringing you this another Facebook Live. Uh, we've been talking about nutrition over the last few days. We have recorded about 5 videos on nutrition. So please reach out to our YouTube channel to watch those videos. Uh, we also are growing on our Facebook page. We have about 27,000 followers now from all over the world. So today I'm going to do this afternoon short live on a specific heart condition called atrial fibrillation. Atrial fibrillation, very common condition. Almost 5 million Americans have it. After age 80, actually, it's almost 15 to 20% of Americans have atrial fibrillation. About 3 to 4% after age 60. So very common condition. So what is atrial fibrillation? Atrial fibrillation is a condition where upper part of the heart, the atrium, becomes very irregular. The upper part of the heart starts going at a rate of about 500. And that speeds up the lower part of the heart, not typically the same rate, but at about 60 to 200 rate. So atrial fibrillation has an irregularity in the upper part of the heart in atrium, and that leads to overall speeding up of the lower part of the heart, the ventricle itself. So how can we diagnose atrial fibrillation? Many times atrial fibrillation can be asymptomatic. That means it can be silent and not cause any symptoms at all. If that's the case, EKG is the best way to diagnose atrial fibrillation. So I always recommend all my patients that after age 65, they should have an EKG every year, particularly if they have a high blood pressure, diabetes, which we will talk about it. After age 50, doing EKG once a year is a very fair call also, because like I said, atrial fibrillation can be very asymptomatic, very silent, very quiet in many patients. And we need to know why a person is going in atrial fibrillation also. So what are the causes of atrial fibrillation? What leads to atrial fibrillation? The most common cause is aging. As we get older, our atrium starts getting stiffer, the upper part of the heart, upper chamber of the heart, and we have a higher chance of having atrial fibrillation. Some of the other common conditions including having high blood pressure, particularly long-standing high blood pressure, obesity, heart disease like heart failure and heart blockage, heart valve problems, particularly mitral valve problems, thyroid condition, particularly high levels of thyroid, hyperthyroidism, drinking excessive alcohol and having binge of alcohol, drinking a lot of caffeine, and having a sleep apnea. There are many other causes, but these are some of the common causes of atrial fibrillation. So what are the symptoms of atrial fibrillation? People with atrial fibrillation, like I said earlier, can be quiet or no symptoms, or they may feel racing of the heartbeats, or they may feel shortness of breath, they may feel more fatigue, sometimes they may get chest pain. So again, fibrillation can have a variety of symptoms, but sometimes it can be silent and have no symptoms. EKG is the best way to diagnose atrial fibrillation. And like I said, everybody after age 65 should get once a year EKG in their primary care office or their cardiology office. So what other tests we do for atrial fibrillation? Every patient with atrial fibrillation should get an echocardiogram or an ultrasound of the heart to look at the size of the atrium, the upper chamber of the heart, the function of the ventricle, the lower chamber of the heart valves, the covering of the heart. So again, echocardiogram is a must test for people with atrial fibrillation. Sometimes we also do a stress test also. Sometimes we will do a 24-hour or 2-week monitor to see how fast the fibrillation is going, how slow the fibrillation is going. Some patients with fibrillation can go very slow on their heart rate, and we need to make sure that they are not in need of a pacemaker. Few percent of population with fibrillation may end up eventually getting a pacemaker, but we will do a 24-hour monitor or a 2-week monitor. So what are the treatment for fibrillation? When we have a patient with atrial fibrillation, there are two goals. One goal is to rate control, where fibrillation is not going fast, and we can use medications for that. Other goal is a rhythm control, where we sometimes try to convert the patient from fibrillation to good rhythm. Many times to do that, a patient may require electrical shock to their heart, we call cardioversion. So again, if a person with atrial fibrillation, giving electrical shock to the heart is a common therapy. Sometimes we will use medications to control the rhythm also. So again, rate control to slow down the heart rate in the fibrillation, and rhythm control where we bring the patient back from atrial fibrillation to the sinus rhythm or good rhythm. The third goal in atrial fibrillation, particularly people who are at high risk for developing stroke, is a stroke prevention. So who are the patients who are at high risk of stroke with fibrillation? When the atrial fibrillation happens, the upper part of the heart is essentially quivering and not contracting efficiently. And for that reason, there is a stagnation of blood in the upper part of the heart, and that leads to clot formation in the upper part of the heart. And if any of those clots travel to the brain, we call embolic stroke, then stroke can happen. And that's the reason many times with fibrillation, we really worry about person developing a stroke. And for that reason, the recommendation is to use anticoagulation or blood thinner medicine. We have now newer blood thinner medicines which are somewhat safer than some of the older blood thinner medicine like Coumadin or warfarin. Many of you have heard about medicine called Xarelto or Eliquis. Those medications are the one which are newer blood thinner medications and we use in fibrillation. So if a person has a history of high blood pressure, diabetes, if a person is 75 years or older, a person has a history of heart failure, and if a person has a history of stroke or a mini stroke called TIA, then that person definitely will require blood thinner medication. Obviously, talk to your doctor, talk to your primary care, talk to your cardiologist to see whether you need a blood thinner medication or not. For a low risk patient, sometimes we use aspirin, but we are realizing more and more that aspirin many times is not sufficient, and person with fibrillation may need to be on a blood thinner long term. Blood thinner in most patients a very safe medication. Obviously, it's somewhat expensive medicine currently, but once they go generic, it will be much cheaper medication. I prescribe blood thinner in all atrial fibrillation when it's indicated, and definitely I highly recommend that you talk to your primary care or your cardiologist whether you need a blood thinner if you have atrial fibrillation. There are some of the other treatment for fibrillation. One of the common one is we call ablation, where an electrophysiologist or a cardiologist who specializes into electrical rhythm of the heart will go through the groin, go up to the heart and burn certain areas of the heart so fibrillation will be resolved. Again, this is ablation. Sometimes a surgical procedure is done called maze procedure, where a surgeon will cut certain fibers in the upper part of the heart and atrium, and that can also stop fibrillation keep happening again and again. Sometimes when a person cannot take a blood thinner medicine, we put a device in the upper chamber of the heart called atrial appendage, left atrial appendage, where typically the clots form, and that device actually occludes that appendage, and that prevents future strokes. So again, talk to your cardiologist about further options in fibrillation, whether you need to take medication to control the rate of fibrillation, to control the rhythm of fibrillation. That means bringing back in a good rhythm. Whether a person needs a cardioversion or electrical shock therapy, a person needs a blood thinner or not, and obviously a person cannot take blood thinner and if fibrillation is just persistent, whether they can have a device to prevent the future strokes or not. So again, fibrillation, very common condition. I want all of you to be aware of it. I want all of you to have electrocardiogram done after age 65 every year. After age 50, if you have a high blood pressure or any other heart condition, then definitely every year. And then if you are having any racing of the heartbeat or irregular heartbeat, then do an EKG or do a 24-hour or 2-week monitor to make sure there is no fibrillation. Fibrillation can be managed very effectively with medications and with proper blood thinners, and all the complications can be prevented if fibrillation is taken care of properly. So again, make sure that if you have any risk of fibrillation, I give you all the reasons why people develop fibrillation. If you are at risk of developing atrial fibrillation, you keep an eye on it. There are actually now iPhone or Android phone based devices which can actually diagnose atrial fibrillation. Look into them. I will put some names on it. But again, beware of atrial fibrillation. I'll conclude here. This video will be on YouTube. There are other videos on atrial fibrillation on YouTube also, so please watch them, read about them, Google them, but definitely be more knowledgeable. Again, if you like this video, share on your page. Share our YouTube videos with your friends and family. And I'll stop here. Thank you.